How do you get out of pain and injuries and stay away from them for good? Well, most people, when they think about handling their injuries, they immediately think painkillers or the RICE method, which RICE stands for rest, ice, compression, elevation. But I don't think these are the most effective methods of actually handling the pain and injury. Rather, I think they just mask the problem. The doctor that came up with the RICE method in the 70s actually has went back and said that he was wrong, and now instead of rest and ice being the first two, he now recommends movement and exercise as his first two. This means moving the joint to promote blood flow and then progressively strengthening the area. Inflammation or swelling in the joint is often thought of as a bad thing, but is actually essential for starting to heal the area because it signals to your body to promote blood flow and deliver nutrients and start the healing process in that area. When you do things like ice or take painkillers, you're actually reducing the inflammation in the area and reducing the pain in the area. And most people think this is good, but reducing the inflammation may actually be slowing the healing process, and reducing the pain gets you out there and back to performing your sport or doing whatever you do in your day-to-day life faster. But it's not actually getting rid of the pain, so it's just masking it, which could lead to you going out and pushing your joint past its limits, and it might be injured and needs to be taken care of, but you're actually just pushing it past its limits, and this can lead to further injury and more problems. So what we want to do to actually strengthen an area is to begin getting blood flow to the area to help promote circulation and healing to the area. And then over time, as it is pain free, you can start loading the area and the muscles around it and the connective tissue and joint and all that stuff. With progressive strengthening in the joints and the muscles involved in the injury, you can actually build strength not only in your muscles but in the tendons themselves as well. The connective tissue, which is things like tendons, ligaments, like a meniscus in your knee, those things are trained by full ranges of motion things. So partial ranges aren't necessarily bad, but they're more focused on growing the muscle. But if your tendons and ligaments and structures of the joint can't handle the strength of the muscle, then this puts you at risk of further injury. Most people who have pain and injuries don't injure the muscles themselves, but rather like sprain their ankle or have tendonitis in their knee or things like that that involve the connective tissues. So that's why we need to work on directly targeting those areas and starting to develop strength in them. So over the years of only working in partial ranges of motion, it's no wonder why a lot of people have muscles that seem to be strong, but they don't also equally have those strong tendons and ligaments that can actually handle the forces of the muscles and the demands of the sport. So once I started targeting my weaknesses and working on these weak muscles in my body, or taking my body through full ranges of motion to develop the tendons and ligaments involved as well, my pain started to go away, my strength went up, and all while working like pain free, where I had been doing like any rehab that I was doing before that was always like slightly painful, and I was told to just push through it. Working at your pain free level is something that is so important, and I keep repeating it because if you, for example, like with your tendons, if you're always working through tendon pain, then that means you're always doing more than your body's capable of handling. So while you think you're actually helping the issue, you're actually slowly breaking it down more and making it worse. Whereas if you were to work without pain and just do as much as you can without pain and target the areas that you have problems with, then you would be strengthening the areas and slowly over time building up strength. Like I said, you can build strength in tendons and ligaments and connective tissue in your body. Then the great thing is that once you get your body out of pain and injury, it's these same exercises just with more weight or a harder version of the exercise that are still targeting these same areas. And those exercises are what can lead to more athleticism, just more bulletproofing in your body, which is like just your ability to stay out of pain and not have to deal with injuries in the future, because you have a body that not only is strong muscularly but also has tendons and ligaments that can keep up with it. I know that these pain and injuries suck, and no one wants to be dealing with them. I'm not trying to bash anybody else's way of training, and if you've been doing it kind of the conventional way and it's working well for you and you enjoy it and you're not in pain, then I'm not saying stop doing that. I think that's amazing if that works for you. But I know that for myself, it didn't really help me a lot, and it just kept me in the loop of getting injured over and over again. So if you want to start training differently, then maybe applying some of these principles or like looking into some exercises that are recommended. I mean, they're not my exercises. I didn't come up with them. They're like, I learned them from other people and the people at ATG. And you should check out Knees Over Toes guy on Instagram, YouTube. He's great, and that's where all this stuff comes from, and that's where I learned it. But like if you like look at some of the other videos on my Instagram and YouTube, and you like go ahead, take the exercises. I don't they're not my exercises. I'm not going to be upset if you are doing them and they're working great for you. I think that's amazing. But and if it's something where like you're having some trouble with the exercises, like, yeah, they are exercises that target those areas, so they might be a little hard to do. So if you want like a structured program or anything like that, then you can like work with me, and I'd be happy to work with you and figure out what's right with you and work with you towards your goals. But using these methods has helped me significantly in my road to getting out of injury and getting pain free. And I've been able to help other people using these methods, and like the ATG system as a whole. There's plenty of other people who are teaching and like working with people doing the same stuff that I'm talking about, and it's gotten so many great results. So if you're interested, just let me know, send me a message. I'd love to work with you.